First of all, I would like to know about the nature of your job. How is it challenging for you to continue your treatments and all that?
Now, as you introduced, I am the head of the Counselling Unit, National Cancer Institute, Maharagama. So, my work there means as a doctor, as a counselor, and as a human to help needy patients. So, we all know cancer. The word cancer, it's very challenging word, and it's very people, they don't want to hear that word. So they get fear, and they get confused, and they get frustrated, and there is a big social stigma about cancer, even in 21st century now. So I work place where all the patients is having that disease, cancer. And now this is 2015 in Sri Lanka. If you take the largest number of patients who are dying out of disease, it is heart disease. But 2020, very near future, only 5 years ahead, so oncology or the cancer will overtake that, and in 2020 cancer will be the leading cause of death. So it is high time to talk about that. So now you ask Bante, what is my job and how what I am doing. So as a doctor, medical officer, it's a noble profession where you can help, you can treat patients. Now especially in this case, in the cancer hospital, I can treat the cancer patients. And as a counselor or a head of the counselling unit, so as I mentioned earlier, there is a big social stigma. Most of the people, they don't know about cancer. They don't know what is cancer, what are the etiological factors, and how to diagnose, how to prevent, and what are the treatment methods. And most of the people even today, they think if you are diagnosed with cancer, means if you have cancer, that is it. That is the end. Yeah, that is the end, and you are having the death certificate on your before you. So that is the situation. So that kind of, I have to cater that kind of people, the patients in this kind. That is the nature of my job.
You are a counselor.
Yes.
So how do you apply this particular interesting thing for the patients, cancer patients, and how does it work?
Yes. Actually now, as I mentioned earlier, Bhante, now most of the patients, the breaking bad news is very important. That means now your patient is sitting in front of you and you have all the reports. It says this particular patient is having a cancer. So you have to break the bad news. So breaking bad news is the first thing. So there are so many protocols, internationally accepted protocols, and we have our own protocols, means which will suit the Sri Lankan culture, Sri Lankan way, our way. So I'm using that most of the time. I'm using that protocols to first thing is how to break the bad news. So means how to tell that you are having a cancer, because it will take you a long way. If a patient knows that he is having a cancer, there are so many kinds of cancers, cancers, then he or she will be very much interested in whether it's curable or whether I can control it, what are the treatment levels. I think it's fair by the patient to know the disease, the diagnosis. So I have to do that, breaking barriers. Sometimes on the process of treatments, like now we all know cancer, there are major parts of treatments like giving chemotherapy, radiotherapy, surgeries, hormonal therapy, maybe combination. The part of the or in between, like these treatment methods, maybe patients, they don't want to get that. So again they come to me, so I have to explain what is it, what are the side effects, how you are going to face it, and what will be the outcome. So many things, because cancer treatment also, sometimes it's very difficult for
and we have seen kind of bodily changes taking place.
Yes, very rapidly, yes. And I would put like this, now cancer is like a journey, what you call a cancer journey. You start from the diagnosis and you have to end somewhere. Maybe that destination will be the totally complete recovery, maybe relapses, maybe you can control it, maybe death, you don't know. So that is the journey.
Anything can happen.
Anything can happen anytime. So, but if you have started your journey, cancer journey, so in between that journey, so you have to face, as you mentioned very correctly, very rapid changes. It's not only physical, but also the mental changes and the social changes.
So like
and the
mental
spiritual
collapse.
Yes, depression, anxiety, mental, some phobias, and those are the mental things. Physical things, of course, pain, aches, some symptoms related to cancer or the drug side effects, or maybe you are losing body parts, like if you do amputation, so your leg is, if you do a hand amputation, so you have to live without hand. If now for the females, if the breast is removed, so you are
this is very common.
Very common. It is the commonest cancer among females. Or into organs, some organs maybe you have to remove. So that is physical. Physically you have to face it. Now, for example, if a patient with rectum cancer, very low end, so we do some surgeries. We are removing entire cancer from the down part, and the defecation is happening through the colostomy or ileostomy. Sometimes urostomy, you have to pass the urine. So like that, it's another chapter of your life. Earlier you had the normal part, now you have the back. So it's a physical, mental and social. Of course it's a spiritual change. Your thinking pattern, how you face to the society, and everything changing. So that kind of patients we have to handle.
Now you use this particular spiritual.
Yes.
I know the fact that you have mastered some Buddhist courses. So how this knowledge of Buddhism is helpful for your counseling?
Yeah, actually, Bhante, I think that is the main point what I am using now to help the needy patients, cancer patients. The Lord Buddha's philosophy. According to me, this is the greatest philosophy which can happen in this world, or maybe beyond universal truth. This is the universal truth. So Lord Buddha said his visionary mind gives us all the counseling skills and counseling aspects. Now, if you take counseling skills, now there's the very good counseling skill is active listening.
Okay.
So he also said how to listen. In all these doctrine sutras, you can see various sutras. So listening,
significance of listening.
And the talking. So, and Bhante, now if you take communication, there are verbal and non-verbal communication. So communication, words can do only 7% of communication. 35% the tone, the pitch, the way you talk. The 55% of communication is your body language. So Lord Buddha, his voice. So you can get it's a Karna Sukha.
This is what we see from the text.
Ubhasi, Karna Sukha, like it's very Nimnada, so many wordings.
We have some in the text. We have Nila, Karna Sukha, Hadayangama, Hori, Bahujana, and very soothing words.
Very, very soothing words. With loving kindness, compassion, and those things, it's very important for the counselor, especially for the cancer counselor. And he said in Dhammapada, this very famous Arogya Paramalabha, Santutti Paramadana, Viswasa Paramanyati, and Nibbana Paramasutta, which is now, if you can see, he was very concerned about 4 main aspects of health. The definition of health in WHO, World Health Organization, they also say. So Lord Buddha, he mentioned this. He was very concerned about the physical well-being, about the mental well-being, about the social well-being, of course about the spiritual well-being. And he found and he gave this philosophy, means through Nibbana, you can, if you fulfill Nibbana, then you are out of all sufferings. So these cancer patients, their suffering may be limited to this world. But still, if we are not approached the Arahantaship, still we have to suffer.
Suffering in the
samsaric existence. So his teachings, his philosophy, the Lord Buddha's philosophy, I am getting more and more to heal the unhealed hearts of the patients.
Dr. Samadhi, the major reason that I wanted you to be here is to know about your hospices that you are running in Anuradhapura. What are you doing there?
Actually, Bhante, the concept of hospice, first of all we have to know what is it. Hospice is a place where you keep terminally ill patients or patients with life-limiting illnesses. So normally in the hospices, patients who are in the hospices, they will live up to 3 months to 6 months. After that they are dying. So hospice concept is very new to Sri Lanka, but other countries they have hospices, especially patients with cancer. It's now cancer, I can say the 60% of patients mainly from cancer, because some cancers it's life-limiting, life-threatening illnesses. So where you are keeping patients, it's not a hospital, it's not a home, it's a place in between where you can manage physically the patient. It means the medications, mostly the symptom control, mainly it's pain control, because these life-limiting illnesses, patients with life-limiting illnesses, they have unbearable pain as a physical symptom. So you have to concentrate on pain management. Then the other symptoms related to the disease, that is physical part, you have to get down. And in the hospices, you have to concentrate about the mental part, mental satisfaction of the patient. That is mental well-being. Because now, as I mentioned earlier, you are in a dying process. So I believe personally, and it's a human.
Are they incurable patients?
Yes, they are incurable. They are incurable, but we can do lot. So it is like you are putting days into their lives. Every day it's very valuable in their lives. So mentally also you have to prepare them for the death sometime. And
this is a significant period of
significant period, very significant period. And every person, you, me, and every personality in this world, we are dying only once. So you have to die
in one particular
time. You have to die with dignity. So hospice is the place where you provide that dignity for the patients. Yes, you can die very peacefully, pain-free, without any struggling or suffering. That is the mental, psychological part. And the social part also. You have the social well-being of the patient. Now, most of the terminally ill patients or life-limiting illnesses, patients with life-limiting illnesses, they are isolated. Because now just imagine patient with a huge fungating wound, very bad odor, maybe some maggots, yes, and very limited functions, maybe bowel, bladder functions, they cannot go, they cannot use the washroom.
Even within the family they are neglected.
Neglected, socially or neglected. Maybe they are disfigured due to the disease. Yeah, so they are socially isolated. But in hospices, it's not like that. We give them priority. So we are taking care of patients. That is social well-being also is there. And mostly and very strongly we are providing the spiritual care because they are in their dying process. So maybe they have some unfinished businesses to do. So maybe not the social problem but spirituality. So they have to think about their death, how they want to die, and are they prepared for their death, and what will happen after death. So there, the Buddhist philosophy, Buddhist concept,
irrespective of the religion,
irrespective of the religion, the greatest philosophy, the Lord Buddha's philosophy comes there, and you can discuss about death, and are you prepared, what are the things. So that period is very golden. So I put it's a golden hour.
Right, making them ready for the death.
Yes.
So they are mentally.
Yes. So in hospices, not only patient we are preparing, they are loved one also. So hospices, in our Anuradhapura hospice, we have that facilities. What you call anytime, any relative or the people known to the patient, they can visit anytime. They can stay with them. They can take care of
Which
them.
is very good.
Very good. Because you have
in
to
a hospital, these things are
because limited time, restricted.
Yeah.
So now then they can come. Maybe now the relatives, they can be with the patient for 2 days. So that's fine. After that they have to do their work. That time we are looking after the patient. So that facility also there. And the respite care. What you call the respite care is, if there is a patient, now most of us, maybe everybody, we want to die at our home. That is the most precious place. Yes. So, but sometimes the caregivers, primary caregivers, they get fed up. They also need self-care. So then you can transfer that patient to the hospice, and we are taking care for a period of time, like 2-3 weeks, maybe 1 month. So then the primary caregivers, they can have their own time, they can look after themselves, then again they can take their loved one back and looking at that, what we call the respite care. So the Anuradhapura hospice, we have the capacity of 42 beds. It's a 2-story building. The land was donated by one of our patients. Yes, our patient. She donated the land, and
is he still living? No.
yes, she's still living. Yes, she's still living. And
When did you get the land?
It was 2006. 2006.
When did you start?
From that period, yes, we started, and now 2011 December we entered the first patient. Now maybe we
I heard of some nice story about how you started and
raise funds.
Raise funds.
Yes, yes, Bhante. But because now, as I mentioned earlier, the hospice concept is very new. People, Sri Lankan people, they didn't know about that. So it's my duty to. It is very new to me also, but you have to make awareness. So how I started a walk from Anuradhapura to
Colombo.
No, to Kandy. From the breeze of Sri Mahabodhi to the Sri Dharanavasi, the two relics of Lord Buddha in Kandy. So it took me 5 days walking along the street. It is a big awareness, and I raised nearly 300,000 rupees to start with. Then my parents, my father, I must mention, he helped me a lot. Then other well-wishers, now my family members, extended family and friends, all the well-wishers locally and internationally, their blessing and their support is very, very much important, and we are getting that support, and it's functioning by the Cancer Care Association. So it's now nicely it's happening. Yes.
It's a very good job and a compassionate work.
Yes.
Anyway, how did you get the inspiration for this type of thing?
Actually, of course, the inspiration from the Lord Buddha, his teaching, because when I was reading his teaching, I got that inspiration. So how much now entire samsaric pattern, what you call paramitas, how much he did, and he strived for one aim, to become a Lord Buddha, the enlightenment. After that, from his first sermon to the last sermon, everywhere you can see compassion, love, the genuine love, loving kindness, the Satara Brahma Vihara and everything. So that is, I think, our duty to help now as a doctor, as a counselor, as a human being, to help other needy people, needy humans. That is our duty. So the philosophy of Lord Buddha, that inspiration came to me, and my school, I went to Ananda College. So I was inspired by Ananda College. This is the greatest Buddhist boys' school in Sri Lanka, and my parents, of course my father, his practice. I saw how he developed his his personality through this, and the other, all my teachers, the inspiration I got by that, and maybe it is from samsaric pattern.
Okay. Yes. So our purpose, Doctor, is for other people to listen these words. I think your words will be so important for other people, for their own inspiration. Yes. So thank you very much for coming. I wish you success and good health, and thank you for coming for Saddam Sanya.
Thank you so much, Father, for inviting me, and I saw what you are doing is very wonderful, fantastic, and I also wish all the good health and all the courage to do this good work, continue this work, because this can heal entire nation and the human beings in this world. Thank you.
Thank you. Devan sir.